Hello ma'am, I'm Cristel, a registered pharmacist, your speaker for today. I'm going to address some issues or concerns regarding suppositories. Firstly, what do you think when you hear the word suppository?
It is something that is inserted on body orifices.
Yes ma'am, you are correct. Suppository is a solid medical preparation in a roughly conical or cylindrical shape. It is designed to be inserted to the rectum or vaginal to dissolve. So going back to our topic, ma'am, what do you think is or are the reasons why there are problems regarding the use of suppositories?
I think due to the lack of knowledge, ma'am.
Yes, ma'am, definitely. So that is why I'm here to address that. So the first problem is the storage. Suppositories melts upon insertion in the body. So, what is the normal temperature of our body? It's 37 degrees Celsius, right?
Yes, ma'am.
Yes. So, if the temperature in the environment is around 37 degrees Celsius, what do you think will happen?
It melts, ma'am.
Yes, ma'am, it will melt. So, what should you do to not melt? What should you do for it to not melt? Put it inside a cool place or in a refrigerator but do not freeze it, as freezing the suppository would increase the melting time. And also, you do not want a cold feeling down the area, right?
Yes, ma'am.
In fact, ma'am, there are different types of suppositories. One of this is cocoa butter and glycerinated gelatin suppositories and also polyethylene glycol suppositories. The suppositories with cocoa butter should be stored at less than 30 degrees Celsius and the suppositories with glycerinated gelatin should be stored at 35 degrees Celsius. Both cocoa butter and glycerinated gelatin suppositories is preferably stored in a refrigerator. However, in polyethylene glycol suppositories, it should be stored at usual room temperature without the requirement of refrigeration. Suppositories are usually packed in tin or aluminum, paper, or plastic. Poorly packed suppositories may give rise to staining, breakage, or deformation by melting. So the second concern in suppositories is the route of administration. Route of administration is the path by which a drug is taken into the body. For suppository, it can be inserted via rectal or vaginal route. However, due to the lack of knowledge, people may take it orally, for example. This will lead to no efficacy and of course it may lead to unwanted side effects. So the right route for the administration of suppositories is
Rectal or vaginal route, ma'am.
yes, it should be on those two only and nothing else. The third issue is the use of lubricants. A lubricant helps the suppository more easily slide into the body orifices, like rectum for example. Some people use petroleum jelly or mineral oil to aid the insertion of this. However, the use of this are not suitable for suppositories and of course the body. Thus, one should avoid using petroleum jelly such as Vaseline and mineral oil to lubricate the suppository since it keeps the suppository from melting after it's inserted. The patient may use KY jelly as a lubricant instead. Lastly, the abuse of suppositories. I have a question. At first, did you think that there is an abuse for this type of dosage form?
No, ma'am. I thought all dosage forms or drugs can be subjected to abuse except for suppositories.
Yes, most of the people do not know that there's also a frequent use or abuse going on with suppositories, especially with adults. The recommended use for suppositories is not more than once daily unless otherwise directed by his or her doctor. If this type of product is used too frequently, it may cause loss of normal bowel function and an inability to have bowel movement without using the product, also known as suppository dependence. Abuse of suppositories cannot be tolerated by the body, and so the person may have loose watery stools during bowel movement. The sign and symptoms that the person is abusing the product is diarrhea, abdominal pain, decreased weight, or weakness. Okay, so that is it for today's mini symposium. I hope you got the crucial information and use it when necessary. Thank you for listening.
Thank you, ma'am.